This is one of the presentations that I had recently given at my class. This is about corneal and Menace reflex. Corneal reflex refers to the involuntary blink response which is elicited by corneal stimulation. Menace reflex is the blink response to a sudden visual threat. These two reflexes are involved in giving protection to the eye. The uses of these reflexes are in the evaluation of cranial nerve function and brainstem integrity. Now let us look at the anatomy of the corneal reflex arc. The stimulus is given by touching the cornea. To be specific, the stimulus is given at the limbus, which is the corneoscleral junction. The afferent is taken by the fifth cranial nerve, the first division, that is the ophthalmic division of the trigeminal nerve, and the efferent is given by seventh cranial nerve, which is the facial nerve. The facial nerve innervates the orbicularis oculi, which results in blinking or closure of eyes. The clinical significance is that when there is afferent defect due to lesions in the trigeminal nerve, first part ophthalmic division, or when there is a lesion in the facial nerve, that is in Bell's palsy, this reflex is lost. And corneal reflex is also used to assess the brainstem function in coma patients where it is also lost. Have a look at this video where the wisp of cotton is tried to touch at the limbus, the corneoscleral junction. Now let us look at the anatomy of the Menace reflex arc. The stimulus is given by sudden visual threat, which is, for example, moving the hand towards the eye, like this. It is made sure that no air is blown over the eye so that it does not become similar to the corneal reflex, where there is some kind of sensory response, some kind of sensation elicited on the eye. The afferent is taken by the optic nerve pathway by cranial nerve, second cranial nerve, and it goes to the visual cortex through the visual pathway, which is given here: optic nerve, optic chiasma, optic tract, radiation, and it goes to the visual cortex, and then it comes back as the efferent, which is the seventh cranial nerve, facial nerve, which innervates orbicularis oculi, which results in blinking or closure of the eye. Clinical significance is that it is absent in blindness, that is optic nerve damage, and it differentiates between cortical and peripheral visual loss. And also, the Menace reflex arc requires cortical processing. This is not a true reflex, but it is a learned response. So, when a hand comes towards the eye, one is supposed to get that into the cortex, process in the cortex, and get to know that it is harmful, and it tries to protect the eye by closure. It involves cortical processing and it is a learned response. Now, let us look at another demonstration here. The Menace reflex is trying to be elicited, but here look at the child. The child is not closing the eye. There is another fact which you learn from here, which is that Menace reflex is learned after 6 months of age, whereas the child in here, you get to know that this child is less than 6 months of age. Now look at the other child. Look at that. The child is closing the eyes continuously when the hand is being brought close to the eye. This shows that the child is more than 12 months of age and the Menace reflex is elicited here. Now, comparing corneal and Menace reflex, the stimulus in corneal reflex is touch, where you bring a wisp of cotton at the limbus, whereas Menace reflex is nothing but visual threat. The afferent is different. For sensory one, the touch one, the sensations, it is taken up by the trigeminal nerve, whereas A Menace reflex is taken up by the optic nerve through the visual pathway. The efferent is same for both because the response is the same. It innervates the orbicularis oculi and results in blinking, the seventh cranial nerve, which is facial nerve. And Menace reflex is the one which requires cortical processing. So yes, it requires cortical processing. Now, concluding totally, corneal and Menace reflexes are essential for neurological and ophthalmic evaluation. Corneal reflex is a brainstem mediated reflex, whereas Menace reflex requires cortical processing. It is used to assess cranial nerves, brainstem integrity, and neurological disorders. It is important in diagnosing facial nerve palsy, blindness, and brainstem dysfunction. Thank you.